Cholesterol is a big risk factor for heart disease, but you may not know it's actually a risk factor for dementia and brain disease and stroke as well. Women specifically live on average about 6 years longer than men. We spend a longer period of our lives in poorer health than men. We don't get the same levels of exercise that men do, especially at midlife, because we have primary responsibilities for the children and the home and the spouses and the aging parents. Take the time to have some coffee with someone, take the time to have a laugh or two. If you are in pain or uncomfortable, it's hard to advocate for yourself. Even for me, now I do it, but I literally have to say it, challenge them, do this, ask for an EKG, not because you're sick, but because you're well. And you need to have an EKG on your record so that if something happens to you later, we have something to go back with which to compare. That's the advantage of age and getting to midlife. You kind of get to the point where you say, you know what? Maybe I don't really have to ask your permission anymore.
So, welcome, Dr. Jayne. It is amazing to have you with us here at Movement Living. We're so excited for this conversation and grateful for your time. And I just wanted to start for anyone in our community that doesn't already know you and the work that you do. Can you just tell us who are you and what do you do?
So, my name is Dr. Jayne Morgan. I am a cardiologist. I'm also the vice president of medical affairs for Hello Hearts, a digital heart health company. I also do a social media series called the Stairwell Chronicles. I've received actually a number of awards for that social media series where I sit on my steps for 60 seconds or less and give you really good tips on living your healthiest life and also medical tips and insights into medicine that you may not know of. I'm also a Pilates instructor and I teach Pilates. And I also have a huge, huge, huge focus on women's health through all of our entire life cycle, including pregnancy, all the way through menopause. And I spend a lot of time in this area. And then finally, my bread and butter is really clinical trials and research and representation and development of drugs and devices that are appropriate for all populations, including women who generally are not included in clinical trials. And we extrapolate the data from men and just kind of slap it onto women and move on. So I spend a lot of time in that area as well. And just to let you know, I actually worked in R&D at Abbott, AbbVie, and Solvay Pharmaceuticals for many years, developing drugs. So I sort of know what I'm talking about, writing protocols and developing drugs and enrolling trials and enrolling patients. I did that for any number of years as well. So that is also a part of my portfolio.
I have personal interest in what you say, of course, and I love that little graphic comic that NPR did about your
I
son.
know. Wasn't
Acting
that
up
creative?
was wonderful, and that is totally our message. And Amanda got me started on it. She's a yoga instructor, but she was inspired by one of the series that I produced many, many years ago,
Uh-huh.
and she started just talking about, hey, just move while you're brewing the coffee. You know,
Right.
getting your head around just getting up and moving in any way, shape, or form. And that is really your message for heart
That
health.
is my message. It is my message.
It's your message, especially for women, over 50, 60, 70s. There's a whole new life if you stay healthy and
That's
strong.
right. That's right.
Which is, I think, that's what our message is to our community. Um, there's so many areas, but I wanted to talk personally. Both my parents had strokes stemming from heart problems, arrhythmias, atrial fib, that kind of thing. And so I've been absolutely terrified about, what could happen if your heart isn't healthy
Right.
and the cardiovascular. And what is your, what's your take on, um, how, just cholesterol, that
Mhm.
type of thing? How do you keep that part of your life healthy?
It's incredibly important to manage your cholesterol levels to goal because what we don't do a good job of here in the United States is practicing prevention, right? We are really, really, really good at intervention and treatment and therapies, right? When the patient is sick, we can jump right in, but we really aren't that good at keeping them from being sick in the first place. So Cholesterol is a big risk factor for heart disease, but you may not know it's actually a risk factor for dementia and brain disease and stroke as well. So it's important to keep your levels under control. And I often have patients say to me, I don't want to take medications, or they like to brag to me that, you know what, Dr. Morgan, I'm whatever, 54 and I don't take any medications. Listen, just because you don't take any doesn't mean you don't need any. And I always make that distinction. And it used to be the way that we were trained is that if we're seeing a patient, their blood pressure is elevated, or they're overweight, maybe their glucose is slightly high, for diabetes, or their cholesterol is high. Before offering medications, is exactly the protocol. Before offering medications, you give the patient a chance for behavioral modification. So give the patient 6 months, let them go out and exercise and change their diet and quit smoking and all those things. Then we bring them back in 6 months and we kind of see how they're doing. And if they've gotten, even a little bit better, they can go back out there for another 6 months and just battle it out. Well, here's the problem with that. We understand now. Allowing your blood pressure to be elevated, even to a small degree, like 10 millimeters of mercury, that top number goes from 120 over 80, let's say, to just 130 over 80 or 130 over 85. That 10 millimeter of mercury change increases your risk of heart disease by 20%. So think about if it's up by 20, now your risk of heart disease is up by 40%. And so while it's good to have behavioral modifications, because I'm definitely here to talk about prevention, that's incredibly important. At the point when you're at the physician and you already have these parameters out of whack, we are really at the point of intervention, not prevention. So what we want to do now is treat you and have you do these behavioral modifications. Come back in 6 months. If you're better, we're happy to dial back the medications or even stop them. But at least we haven't had a period of another 6 months to a year when your blood pressure has been high, when your cholesterol has been high, when your weight has been elevated, because we know that that impacts healthy aging. It also impacts longevity. And while women specifically live on average about 6 years longer than men, we spend a longer period of our lives in poorer health than men. So we live longer for more misery because we haven't taken care of ourselves. So it's something just to think about. Part of that is we don't get the same levels of exercise that men do, especially at midlife, because we have primary responsibilities for the children and the home and the spouses and the aging parents and even when there are shared responsibilities in the home, oh, my husband and I share it equally. Turns out that men have more of those responsibilities that are independent, that they can plan around their schedules, like mowing the lawn or making house repairs. So they can still get to the gym. The women have the responsibilities that are built around other people's schedules, getting dinner ready, getting lunch ready, getting the homework done, getting people into the bath at night before you go to bed. Those are all things that are built on other people's schedules, and you don't have as much control. And so even when there's this, oh, we split the household responsibilities equally, even men oftentimes are doing the laundry. Oftentimes the laundry is also something you can do and schedule at your own time. And so women for a big 20-year span get about an hour less of exercise per day than men. And over a lifespan, that really impacts your longevity. That's why we end up in poorer health. We live longer, but the years are not good quality years.
It's such an important message. And I mean, that just speaks so much to what you were saying about prevention also, because it shows that there's a direct link there between women are not getting enough exercise, they're getting less exercise than men, they're taking care of themselves less than men because of these other pressures, and it is actually leading to these poor health outcomes, which,
That's right.
another way of looking at it is that we do have a lot of control over those health outcomes if we can find a way to really do what we need to do. So I'd love to hear from you, like, what are those things that we need to be doing so that we can improve those health outcomes?
So think about some things that, and I'm not, I don't advocate for supplements. I'm not saying that they don't work. I'm not saying that they do work. What I'm saying is many of them, we just don't have the data to prove that they work. So there's a difference between they don't work and we don't have data that proves that they work. And remember, I'm in the business of science. So I want to be clear. I'm not anti-supplements. Many of them probably work. We just don't have the data, so I can't really endorse them. But I will say where we do have data on things like vitamin D and omega-3 fatty acids, right? And so women, I want you to start to begin to check your vitamin D levels, especially by the time you're 35 years of age. This is a great way to take care of your health. And vitamin D supplements are very well regulated. You know what you're getting at the supermarket or drugstore, wherever you're picking them up. Um, and it's not one of these things where, one company gives you one dose, another company gives you another formulation. So vitamin D, definitely make sure that you are supplementing your vitamin D levels. And you would be surprised, many women, I would say almost most women, have low vitamin D levels. So think about that as well. Think about, of course, as well, exercise, sleep. But here's some other things that that we don't really talk about. Um, you know, we used to we noted really that women lived longer than men, but have this poor quality of life. And we equated it to women who were married tended to have a longer life than women who were single. I mean, so it's, oh, there's something in that institution of being married that prolongs a woman's life. Now, most women who are married didn't see the logic in that. However, that was what we were thought because they looked at women who were married. That's a great example of research where the variables are confounded, right? You're looking at one thing, you're not looking at all the other variables. Turns out that women who are married often, not all the time, often also were in a community, oftentimes built around their children, where they had meaningful relationships with other women that were nurturing and supportive. And it turns out when you control for marriage and just look at all women, whether they're married or not, whether they're in heterosexual relationships or not, and had meaningful relationships in a community with other women, those are the ones who are living longer. Now, I'm not saying, once again, like supplements, don't get married. I'm not saying that. So I don't want to leave the podcast next day. Dr. Morgan said, don't take supplements and don't get married and all of these kinds of things. What I'm saying is relationships, meaningful relationships matter. So take the time to nurture your relationships with other women. Take the time to have some coffee with someone. Take the time to have a laugh or two, even if that laugh or two is about your misery. Shared misery can actually be funny if the two of you can talk about it. And so that's actually very, very important. And we found as well, when we look at these blue zones, I don't know if people know what these blue zones are. So these are areas in the world, all over the world, where for whatever reason, you have pockets of people that are living a long time. And it turns out they're in different environments. Some are at high altitudes, some are at low altitudes, some are actually eating high fat diets. They're drinking goat milk and making their cheese and drinking wine every day, like this village in Italy. Others are subsisting on whole grains, and others don't have a lot of furniture, so they sit on the floor and they're getting up and down all the time. And their legs and their core is so strong, and they're riding horses. But it turns out part of the common thread is they all live in close communities. And they all take the time to, they sort of do everything together in the community. So it's something just to think about with regard to longevity, especially for women. We get busy, we lose track of our friends, we have so much going on, we can't return a phone call. We just say, give a heart to a text and keep going. Think about over time that erodes your quality of life and your longevity. Think about it in that way and make time for it.
You have many ways of looking, fresh ways of looking at things, and I really appreciate that, such as, the dividing of jobs aren't really quite equal to get us to be able to help. How does that affect how women deal with their doctors or with their medical professionals? Just speak a little to the cultural differences.
Right. And, so it's really important to have some cultural congruence, meaning that the patient feels a relationship with the doctor, feels that the doctor, in other words, the doctor hears her and sees her. And she's not either constantly trying to explain herself or more commonly feels judged, feels misunderstood, can't find the words to disagree. um, they know that that's not exactly what they were trying to say, and then what do? You give up and you leave the doctor's office with more questions than you even came in with. You didn't get anything answered. You left with even more issues. And then you go home and you feel defeated and the medical system doesn't work for you, so why should I go anyway? And, I really don't like those doctors and they don't understand me. Um, and I did a post recently that actually wasn't my post. I reposted it, of just medical documentation, and just as
Love that.
women of all cultures feel it and think it, the reason we feel it and think it's because it's actually happening, right? So believe your intuition. We are judging you and documenting our interactions with you with the subtleties of language that are driving those results. So, you know, you can go and look at some of my posts, just the different ways that the same interactions with a white patient and a black patient might be documented differently just because of inherent biases. But unfortunately, that drives care. That drives whether or not you're going to be prescribed medication or not. Do we think that you are a drug addict, or do we actually think that you have real pain? Do we think that you're going to take your medications, or have we already decided that you're non-compliant without understanding anything about you at all, because you're looking at you from our lived experiences and we don't understand your lived experiences, so we're not asking you the right questions, and we're also not responding to your questions in the right way. And so we spend this time together where nobody's really communicating and everybody leaves and goes their separate ways. The patient goes home and is not any better, and the doctor thinks, "Oh, that was a difficult patient. Every time they come in, I don't get anywhere." And, so that's what that is.
And also the language of, or not, the cultural difference in how we respect or treat doctors, because I know that I'm usually feeling very on their level and say, hey, I've just researched this, and what do you think about this latest study, and that kind of stuff. Or I'm more demanding maybe that way, but
Mhm.
other cultures are much less comfortable in that
Yeah,
situation. And have you
and
found
good
that
for
yourself?
you. Even for me, and I'm in the system, so I'm sort of, as a Black female, I kinda have, as a Black female physician, I have one foot in the system, and then I'm one foot outside the system. So even me, I have a tough time because I'm deferential. And then, if you are in pain or uncomfortable, it's hard to advocate for yourself. Even for me, now I do it, but I literally have to say it, challenge them, do this. And imagine if it's hard for me, how hard it is for someone without my background.
That's right.
And I'm struggling, and I literally have to um, voluntarily say the words to myself to change my behavior. Imagine that I have to say, "Jane, say this," instead of, "Be polite, you're here, you're the patient right now, stop being the doctor, let them do the," even when you don't, so you have all these conversations. I have to unwind and say, "Just stop. Say what you wanna say." I literally have to tell myself that
Yeah.
whenever I'm in the medical establishment, so I know how hard it must be for other people.
I feel like that would be so encouraging, though, for women in our community who really struggle with advocating for themselves and struggle with saying, exactly what you're saying. Say what you want to say what you want to say, to hear you, a doctor, with so much experience, so much background in research and everything. And even you have to give yourself this pep talk. Like, I hear that and I'm like, okay, it's normal. It's okay that I have to give myself the pep talk. I'm going to give myself the pep talk. And I just feel like that it's going to give women permission to have that pep talk with themselves and say
Right.
what they want
I
to say.
literally have to adjust my thinking, and you do it, you're not aware of it, and then you think, "Wait a second, it's not really what I wanted to say, or that's not really what I was thinking," or, "Why am I just letting them do what they want because they must know best, and I'm here," and I have the talk of, "I'm the patient now, stop being the doctor, stop." But the fact of the matter is that's actually just a substitution for you're just being deferential to the system.
You had a post about an ER doctor, just if you at the very least to ask for this test, I think it was an EKG. Can you
Yeah, and so, again, when we're talking about advocating for ourselves, it's hard for women, right? We're not feeling well. Our signs of a heart attack might be different. So we come to the emergency room or even to our doctor's office. We're not feeling well. We don't have crushing chest pain. We don't have chest pressure. We're not short of breath. We don't have any of those classic signs. Um, we may just be fatigued. And imagine all the things we're doing. We have a number of reasons to be fatigued. You may have jaw pain, which may take you to the dentist, or you could just have back pain. Who doesn't have back pain with all the things that women are doing? So, a lot of the symptoms of a heart attack that are more subtle, unfortunately, are also more common in women. And because this is a very patriarchal society and medicine is a very patriarchal system, we don't really learn those other symptoms. In fact, we call them atypical. Speaking of another word that drives behavior, right? So a man comes in and says, "Oh my gosh, he has chest pressure, shortness of breath. Let's take him to the cath lab." A woman comes in, it's like, she's tired and she has some jaw pain. Um, Maybe she needs to rest and she might be having a panic attack and so the man is off in the cath lab getting the therapy he needs, and the woman is sitting, and they will describe it as um, a 44-year-old male has come to the emergency room with classic symptoms of a myocardial infarction, so of a heart attack. They'll describe the woman, 44-year-old female has arrived to the emergency room with atypical chest pain. So who are you getting ready to treat? Think about
yeah,
that. Yet
yeah.
heart disease is the number one killer of women. Right. And that's one of the reasons because of that delay in care. We have a delay in recognizing it through no fault of our own. Nobody teaches us what these symptoms of heart disease are. And then once you get to the medical establishment, they may have a delay. And so here's what I say when I say advocate for yourself. If you're there, you've heard Dr. Morgan talk, you're concerned that you're having a heart attack. Nobody's listening to you because you don't have the typical symptoms of chest pain. You ask them to get an EKG. That's all you do. Don't say, "I heard Dr. Morgan talk. I was listening to this podcast. I was read." It's too hard. Nobody's listening to you. So you've got to speak the language of the system. So when you're speaking the language of the system, especially if you're by yourself, don't waste your words on that. Speak our language. Say, "Doctor, I'd like for you to get an EKG." Now, that's a request that can't be turned down in an emergency room. They got to do it. So once you ask that request, not only would you get an EKG, you're also now prompting the doctors and the nurses to think about something in a different way.
Yeah.
And then your EKG, if it comes back abnormal, off you go to get more therapy, just like the man next to you, who actually you all came in at the same time. He's been gone for 30 minutes to get his care. You've had to ask for an EKG. But anyway, so that's the whole point. Ask for that EKG because even if it comes back normal, you now have prompted the system that you're thinking about something and that they need to be thinking about something. Then if it comes back abnormal, you get to go and have that great care that the man is getting.
Inequality is everywhere,
Right.
everywhere.
And the other thing to think about is when we go in for our annual physical exams, ask for an EKG. Men always get EKGs as part of their physical exam, it's on their records. What do? We get mammograms and pap smears. Now, we need mammograms and pap smears. That's one of the reasons that the risk of breast cancer has decreased and cervical cancer because we have advocated for this screening. And again, I want to be clear that I'm not trying to tell people not to get mammograms and pap smears. This is incredibly important. I'm not saying substitute something. I want you to add something. In addition to that mammogram and pap smear, ask for an EKG, not because you're sick, but because you're well. And you need to have an EKG on your record so that if something happens to you later, we have something to go back with which to compare. Men, that's high level of care. Men always have that EKG through which we can go back through our records and look and see what those changes are and over what period of time. Women, it's like, oh, they don't have an EKG. This is the first one. And we just have to start from where we are, right? We've got to play the hand that we're dealt. Men get a better hand, right? They get the jokers dealt to them because they've had EKGs. We can go back and actually we know the period of time during which the change occurred. So again, I'm not saying don't skip your mammogram and your pap smears. I'm saying do those things and add an EKG, especially if you're feeling well. You just want it on your record. That's it.
So how did you get so passionate about both advocacy, health advocacy, but particularly heart advocacy?
Yeah, as a cardiologist, I mean, I trained like all the other cardiologists. But even through medical school and residency, I could see there was so many things that were overlooked in Black patients that were dismissed, that that were described incorrectly. And when I would speak with my instructors, I mean, really, they didn't know the difference because that's how they were learned. That's how they were taught. That's how they learned. And even especially with dermatologic presentations of things, skin presentations, it was just it was almost a nightmare. It was just eye-opening. But you've got to get through the system as the system is set up. But these things weren't working. Even, with the way we were there were so many race factors in different formulas that we were using on patients. So how we're calculating the kidney functioning, how we are measuring the oxygen levels. And it was just on and on and on. The system is just churning and everyone's blind to it. But I wasn't blind to it. And not just me. My fellow medical students also were kind of like, WTF? But we got to take the exams like everybody else, right? Um, finally, I'm 30 years out, 40 years out, 30 something. They finally have retracted the pregnancy race factor, which relegated Black women to repeat cesarean sections, but white women were able to have vaginal deliveries. Black and Hispanic women, they have finally turned back the kidney the kidney function race factor in that formula. And in doing so, they've had to go back and look at all of these patients who should have been referred for kidney transplant and instead were sent home. Imagine you should have had a kidney transplant. Instead, you're sent home because when you put the race factor in, they determine that you don't meet the metrics. And so imagine how much longer, as we know, most medical conditions don't get better on their own. So they've been at home deteriorating. And then here's the sad part. By the time we were able to course correct and get them and put them on the transplant list, some of them were no longer eligible because their kidneys had deteriorated that much. So
It got you excited. I mean, it got you so
yeah,
upset. And
bewildered. I would not say excited at first. I was bewildered. I was struggling to understand it. I first went to my instructors. We call them attendings. They didn't really have any answers for me. White attendings, they had never even come to their attention. They had never heard of it. Everything seems fine. And I think that was the part where was like, oh my gosh, there's no support. Nobody knows what's going on. And this is just going on and on. And this is how I'm trained. Um, and, unfortunately, I just accepted the system and was a part of the system for a long time. And I think we're back to kind of what it's like to be a patient. It's also what it's like to be a minor player in a big system and have powerlessness. I can't go up against the whole system. So maybe the best I can do is just do better for my patients. But how can I fight the whole system? And that's the advantage of age and getting to midlife. You kind of get to the point where you say, you know what? Maybe I don't really have to ask your permission anymore. Why did I ever think that I did? Hmm. you know
yeah,
and you go on to other things, And that's, being a little bit more seasoned and being a little braver. But the fact of the matter is when you are a young doctor, when you're at the mercy of the system to make a living. You don't really know where you're getting support. Maybe nobody's going to believe you. So it's the same thing that women experience and minorities in the medical system as a patient. You can't go up against the system.
Yeah,
So
yeah.
so that's kind of where it also was a long process over decades
Mm,
to me getting to the point where I found my voice to
mm.
speak and felt brave enough to find my voice and to kind of let the chips fall where they may. Like I didn't really know what was going to happen if I said something, you know, that's the truth. And I said to my husband, I was like, well, I might not have a job. I don't know. Get ready. I don't
I
know.
love it. I love it. I love it. Thank you for saying that because we're all, I mean, age wise, it's so important to just say, hey, I'm going to say it now. I'm going
Right.
to do it and be it. So this is a huge message for us.
Yeah.
Appreciate that. That's
Yeah.
great.
It's not easy. That's why I say I know exactly what it's like to not speak up. I've spent my whole life not speaking up. Don't think that the person you see now was just born this way. I wasn't just born. Like I didn't just happen. These are many life experiences and finally finding my voice late. So find your voice earlier, be better than I am. Do more than I do. Do it earlier, do it sooner, be braver, have courage, speak up for others, and don't keep your head down to try to survive, even though you see things are not correct around you. Speak up for people who can't speak for themselves. I know easier said than done. I'm telling you all this, and I didn't do any of it, right? I didn't do any of all any of the things I just told you.
Yeah, you're an inspiration, and that's what we need to hear so much. And we thank you so much for that and your advocacy and your fun. You have a really fun attitude too, which is lovely. And Pilates and everything. I mean,
Yeah.
Yeah, we would love to hear more about the Pilates and I mean, there's so many more things that we can chat about. And I
Oh,
know you need to go now, and we
yeah,
so appreciate your time,
thank
Dr.
you.
Jayne Morgan.
Yeah,
It's
and
just
people can follow me on Instagram at Dr. Jayne Morgan, DrJayneMorgan. I'm on Instagram, on LinkedIn, I'm on, X, Threads, TikTok. I'm on a lot of the areas. So, and follow my Stairwell Chronicles. Today, I talked about just how to measure your blood pressure and what your arm position is
all
on my
that.
Stairwell Chronicles. So go back and look through Stairwell Chronicles and get little 60-second tidbits, just little
Yeah.
things that might help you in your life.
Yeah, I love it. I want to check the books that you use to make a desk up, and I'll get the right height because I saw that it was fun. So good for you. Very creative. Thank you. It was lovely to meet you.
Thank you. It was a pleasure. Thank you guys for inviting me here. Please
Yeah.
invite me back. I would love it.
Okay.
of
Take care.
course. Thank you so much, Dr. Jayne.
Bye.
Have a good
Thank
day.
you.
Bye.
Yeah. Bye.